put together last year, so that would give us time to work on healthcare expansion. So today I'm really here to share with you what I consider maybe some good news and some bad news. The bad news first. The bad news, we, the state of Maine, did not expand health coverage to the less than fortunate individuals. The good news is we can accomplish this task today by what we've learned from other states, their best management practice to extend this coverage. Most importantly, we can extend it to those people living in poverty, to provide help for mental health care, drug addiction treatment, counseling, and preventative health care procedures to those individuals and families. We can do this by using private insurance market in combination with Maine Care. We can do it by recapturing our tax dollars, which are going to other states that have already expanded their health coverage. We can do this by requiring those to take advantage of this coverage to share the cost. We can ask those individuals to be helped with unemployment situations if they are in fact unemployed, working with our Department of Labor. We can work with our corrections group, local, county, and state level to provide mental health and addiction counseling to those that are incarcerated. We have the ability in this bill to say no if the federal government reneges on their commitment. And we've established milestones to monitor the progress and savings attributed to the expanded coverage. LD 633 addresses Maine's addiction crisis by, one, providing positive incentives to people who enroll in treatment and wellness initiatives aimed at reducing and managing substance abuse and mental health disorders. We can authorize the Maine criminal justice and correction systems to provide coverage using enhanced federal funds instead of state funds to pay for health care services provided to inmates who are hospitalized. We can authorize Maine's correction systems, like other states, to assist inmates with drug addiction, mental health diagnosis, and other chronic diseases with the application for health care coverage when released from jail or prison. We can create savings in Maine's state budget by enhancing federal funds instead of state funds to provide cost-efficient coverage for a full continuum of substance abuse, mental health treatment, and preventive care to Maine people, Maine uninsured. We can encourage government efficiencies and accountability by ensuring the coverage is contingent upon a waiver or state plan amendment requested by the Centers for Medical and Medicaid Services. We can provide an efficient and effective enrollment services process, which includes using certified applicator assistance in community health centers, insurance brokers, and agents assisting with these applications. We can authorize the state to accept eligibility determinations from the Federal Market Exchange as it's determined to be efficient and effective in enrolling people in the program. This is being done in other states. We can authorize the state to contract with health insurance programs and plans to provide coverage with a maximum savings and to ensure accessibility and quality services. We will require significant reporting as we go along to make sure that this is in fact meeting their statements and the goals that we set. And finally, we can require identifying savings and the revenues placed into a Maine Medicaid stabilization fund to help that. Coverage provided under LD 633 would end if not authorized by the state legislature on June 30th, 2019, and if the enhanced federal management funds decrease below the already established federal law. We are out right now. Today I have a number of other speakers that were going to join me. I did bring my protection in case somebody gets out of hand up here, so it'll be good. But my pleasure to introduce you, Joe Mary, President of the Maine Chiefs Association, the Maine Sheriff's Association. Excuse me, John. Joel.
Good morning. My name is Joel Mary, Saginaw County Sheriff, and I'm also the President of the Maine Sheriff's Association.